Hi, everyone. First of all, I'm honored to be here. And as an Emirati, knowing that the UAE is focusing a lot on AI, especially in the health tech industry, and wanting to make the UAE the capital and the hub for such an initiative, it makes me so proud to be here to share the stage with prominent leaders from the government and industries that can give us an insight on how to make the UAE the next healthcare innovative capital. So thank you so much for joining me on stage. I'm going to start with Dr. Omar. Dr. Omar, you are Executive Officer Director of Department of Health in Abu Dhabi. You hold a big responsibility. And you are known as a leader for shaping the landscape of healthcare in the city of Abu Dhabi. My first question goes to you is, can you elaborate on what effective strategies have been implemented by the DOH to support the innovation and acceleration growth of opportunity?
Thank you very much for having me, and it's great to be with you all. So the main point, if we step back, is around the innovation element. Now the innovation is not an endeavor by one entity or the other, one person or the other. There is no person or entity can say, we hold a monopoly on doing innovation. I think an innovation nowadays, it's a way of life and a way of working. We need to do it all the time. So as a Department of Health or as a government entity, there is acute appreciations on the role of innovation. I think one of the speakers before me was tracking what happened during COVID. And this is a key thing that we need to take away. Today, as the world is emerging from one of the largest or the biggest events that happened in our lifetime, which is COVID-19, a global pandemic, and the word is global. So there was no society, no economy, no country immune from what happened. We coming out on the back of it, and one of the key things that enabled the world, and definitely Abu Dhabi, definitely UAE, to emerge successfully from this was innovation. You look at the solutions, innovation in processes, innovations in medications, innovation in product, innovation in approaches, all driven by, first and foremost, by leadership that believe in it, that see that it's a key element on protecting your society, protecting your economy, and protecting your country, as well as protecting the world. And second is a government entity that realized that the public and the private, healthcare or non-healthcare, should be working together in a new innovative way to tackle this huge pandemic. So you've got, from the Department of Health element, there are new policies. We are the first in the world, in the region, to produce an AI policy in healthcare. That happened about 2 years ago. We are the first in the region to, and I think Robert will talk to it, and to introduce a fully workable health information exchange that enable any patient or any person to have their information logged into one place. It doesn't matter if they go into the furthest clinic in the middle of the desert, or they go to Cleveland or Mayo or SKMC or Pure Health. All of that information will be happening in one place. These are what you call infrastructures that enable innovations to happen. So a leadership that believe in it, policies and programs that drive in it. We today have a Center for Innovations and Research. We have the funding available. We have the open collaborative approach that we're inviting others to work with us. So all of that is creating the environment to enable everybody to participate effectively and efficiently into the process of innovation.
Yeah. As a tech entrepreneur, I know that technology can be a solution, can be innovative, but also technology needs enablers. So my next question is to Dr. Raza. Dr. Raza, you are known for trying to make the UAE the capital of medical tourism. And you are the person that brings the business and enables the technology and the innovation in that sector to thrive. So my question to you is, what is the unique opportunities that are being offered in the region and that is attracting people from all over the world that are not available anywhere else? What makes this part of the world unique?
Thank you very much, and very interesting question and very dear to my heart. I came to UAE 24 years ago to promote India as medical tourism destination. And I used to send hundreds of patients per month to Apollo Hospitals Group for treatment. Today I am proudly sitting here that I have played a very small role in reversing the trend, and today this country has not only become self-sufficient, but also attracting thousands of patients per day. So we have seen the transition. When I came here, the population was 2.5 million, and today we see a population of 10 million, almost 9 million people having access to best healthcare with privatization of insurance, and we have to thank the leadership of this country. We are blessed to be in this country. And I have seen the transition when we used to send patients for basic work, for laparoscopic surgery, for joint replacements to India, and cardiac surgery and other things. Today, such a proud moment that technology, of course, has enabled, but we are able to talk about and we are able to deliver genomics. We are talking about transplants. The most complex procedures today are possible in this country. So this country, over a period of time, we have seen has become a destination for education, destination for tourism, and destination for healthcare. I am fortunate that I got the opportunity, and thank God that, thank Allah for this, that I have been able to set up a couple of hospitals, and the employment generated in this industry is the highest in the world. Like, for example, for one hospital bed, we need to get 8 to 10 people. And so imagine 15,000 hospital beds we have, how much employment we have generated in this country. Now we talk about 4 pillars in healthcare: infrastructure, technology, processes, and skill sets. And this country is comparable to the best in the world in terms of infrastructure, in terms of latest technology, and of course processes, because this is perhaps the only country in the world where each and every hospital is accredited by one of the best institutions in the world, which is able to attract best skill sets from around the world. So today we are sitting comfortably here, having access to best skill sets from all around the world, and thanks to the leadership and the entire ecosystem and evolution of technology which has helped in this. I hope I have answered your question.
No, you did. But as each of you speak, we can see how all these contributions make the ecosystem of innovation in the health sector significant.
So, one more thing, Shaista is sitting here, and Shaista, you raised one question yesterday that anybody in the audience who has spent more than 10 years. So I have spent 24 years, and I have seen the transition of healthcare when patient was holding X-ray in his hand, and we were telling him to come for the report next day. So today, everything is in the hand of the patient. So Alhamdulillah, this country has come to that level, and I am a witness to, from export of healthcare to import of healthcare. And we stand in top 20, top 10 of the world in terms of medical tourism. So it is a compliment of each one of you from healthcare industry, and this is a proud moment for all of us.
Amazing. Dr. Tarek, you are known for your leadership, your extensive experience, how strategic and visionary you are, and you are the driver behind the American hospital's excellence and reach. So my question for you is, what are the methods or the approaches that the American hospital already took towards that vision and implementing already?
You see, that's a good question. What's happened, all of us during the COVID time, we found ourselves, we wake up, that all our plan need to be not only on a fast track, but it's a supercharge. So we need, the challenge for the senior management at that time at the American Hospital is to prepare the team, prepare the institute for the era that's coming after. So we focus on our team, our institute. So we start by collecting the data, knowing where we are, what's area that we can improve in. And as you know, if you cannot measure it, you cannot manage it. The second part we did, we focus on our team. So we try to create a balanced team. a balanced team that started from the senior executive, from the group CEO, go down to the front desk representative in the way that they have a knowledge to support the next change that's happened. You know, as Mr. Ahmed Yahya said, change always have that some resistance to it. The third part, what we did, we focus more on our strategic and vision, and we have all our team members from the group CEO to the front desk manager or worker to be in knowledge where we are going, and everyone attached to KPI to make sure that we're all heading to the right direction. Then we research. We went back and we study our data to see where we use those data in the right way. And we collaborate with some institute. For example, we collaborate with Cerner for the research, AI Research Center, with the Intuitive Da Vinci through the robotics center. We also partner with with a few of well-known universities in the country, University of Sharjah and University of Ras Al to make sure that we are in a line in the education program. And at the end, what we did, we just adapt the BDSA protocol. We just plan it, do it, study it again, and act. Plan it, do it, study it again, and act.
Got it. Robert, you have over 15 years of experience. You wear so many hats. My question for you is, when it comes to Malafi Group, how is it paving the way for a great collaboration between medical practitioners? That's one question. And then I think the most important question as well is, how is the connected healthcare ecosystem improves the quality of patient care, leading to effective diagnosis and a better outcome?
Thank you for the questions, and thank you for having me here today. As Dr. Omar had mentioned earlier, so Malaffi is the first health information exchange in the region. And with that, by the nature of what we do, is we're collaborating with the entire healthcare ecosystem here within the market of Abu Dhabi. So we collect data from both public and private institutions to the tune of, we're almost at 1.2 billion clinical records in our repository today. And so with that, you know, while I'd like to have us take all the credit for it, you know, I'd be lying to you if I said it was all us. It takes a village. You know, it's certainly, you know, having the support of the Department of Health is the pillar that helps us get to where we're at today, but then also the participants. And so we have very open dialogues with the community about where their challenges are and how we can support them with their challenges. So we have both the public and private institutions and their leadership in meetings with us and with the Department of Health, having open and frank conversations about the technical and operational challenges that they face every day. And with the HIE now, the providers can access all of a health patient's information regardless of where they've been seen. And we have information going back to 2013 as well, even though we've been live for, you know, 3.5 years now. So with that, you know, now a provider can access the information and see the entire healthcare history, including medications, clinical documents, lab reports. We just went live with radiology images. And so with that, they have all the information at their hands to make an informed decision. And we're even adding to that now, and again, in support with Department of Health, we've added risk scoring. So we use machine learning models. We have 11 different disease conditions that providers can now see on the entire patient population. And I'm always hesitant when I talk about innovation, but there's nowhere in the world that a health information exchange is doing that at scale the way we're doing that today. And that's because of the healthcare ecosystem within Abu Dhabi, not because of just one group or one organization.
Got it. You spoke about data, and my question to you now is, I think a question that a lot of people think of is that with the increased usage of data, with the predictive analysis and the AI technologies, all these things we see in the movies where we have like machines that can like scan and contactless connection between patients and all that. What can we expect for the future? Like, what's coming?
To me, the future is bright, and I love it. You know, I'm a big believer in leveraging technology to help people in their day-to-day lives. You hear, oh, it's going to take over physicians or take over jobs. I haven't witnessed it in my lifetime. I doubt it'll happen, in my daughter's lifetime. So, I think the future is bright from at least a patient experience, and I love Ahmed's earlier presentation. We probably think alike in our backgrounds, but I think the information is going to support patient journeys. I think having home care devices. I'm not a big use of the healthcare system per se. I try and take care of my health, and I have all these home devices and my Aura ring, right? So as you said, it's just a lot of data, and we have to figure out how to serve that up to the patients and providers in a meaningful way that they can improve their lives. And something that spoke to me a while ago is really how do you bring time back to patients and providers? I think that's the biggest thing that we need to focus on as well.
Got it. Dr. Omar, my question I have an easy one. My question for you is that...
I'm just looking at the clock.
Don't worry, Omar is generous. He'll give us more time.
No, we should be generous. I think the previous speakers took a lot of our time.
Don't worry, we have Wasla here. But the question is, of course, change and innovation is needed. It's something that is happening. You have to embark on, you have to join the ride, and you have to be part of the movement. But why are people moving from old proven methods in the healthcare system to new ones? Again, from proven methods to new ones.
I think we need to focus on the proven part. What we do as doctors, and I think healthcare guys will and that will might be a surprise to many folks who are not healthcare. So what we do today in our hospitals and healthcare, only 45% of it is proven by studies. Everything else, about 55%, is based on experience and based on osmosis of knowledge from one person to the other. So if you go back to about 1910, healthcare used to be very simple, but completely ineffective. This used to be where the average age of individuals around the world will be running around 35, 40. Kings and queens might be lucky to live to 55 and 60s. Nowadays, the average around the world is much better. So even the person that is in the poorest part where there is no healthcare provided is living more than the person that used to be living in 1910. Now, why we moving and why we had to, there is no had to. We need to accept it. This is the way of life that we need to have. So things are changing. The people will be growing up. Today in UAE, it's a fairly young country. Actually, it's a very young country. But in the next 10 years and the next 20 years, this is going to change. There's going to be a shift in the population demographics towards the older age where there are more chronic diseases. Actually, if you look at the global level, there are countries in recession in terms of population and in recession in terms of resources. In UAE, if we want to be part of the future of healthcare, we need to innovate now.
Yeah.
We need it, otherwise, in the future, in 10 years or 20 years' time, we'll only be consumers. There is a fast train going, and unless we jump into it, it's going to be leaving. And that fast train doesn't come back. So it's a one way. It's one way into the future. You asked Robert about what the future holds. The future is only limited by our imagination. If you can imagine it, it will happen. So whatever you imagine the future will be, you need to work towards it. Of course, with the technology, with the resources, with the processes, everything will be happening. So aging population, we are shifting to, I feel, I concur with Robert, it's a great place, but we need to accept innovation as a daily part of life, similar to eating, drinking, working. It's not a change. It's daily life. We need to innovate. We need to innovate all the time. We need to examine and critically question every process, every technology, everything that we are doing in healthcare in order to improve it. Otherwise, we'll be left way behind. If you look at COVID, and one of the key things, again, back on it. So if you look at the vaccine journey, vaccines used to take, the first vaccine took about 100 years. The vaccine journey took about 7 to 8 years to get established. The triumph to science that it happened within 10 months. It saved countless lives running into the millions and get economy out of the way. If you look at UAE, we did really well. We have one of the strongest economies globally today. 11.6% growth in GDP. Only for Abu Dhabi at UAE, it's about 8%. Healthcare alone in Abu Dhabi has grown by 29.9% within 1 year. Okay? And we were the second lowest mortality rate globally in a global pandemic. We have one of the lowest infection rate running all the way through the years, and we continue to be highest vaccination rate, highest testing per capita. All of this is not just plugged out of thin air and done. Actually, it's processes on innovations. The likes of Pure Health, the likes of SKMC, the likes of Mubadala, everybody together, and we're even shifting the way we think in an innovative way to arrive what we are today.
Dr. Tarek, we spoke about how the American hospital is contributing. Now, I want to ask you from a personal perspective, from your experience, how are you personally contributing through your innovative medical expertise and your specialties across different fields and various fields? How are you fostering the growth of opportunity in the healthcare sector?
You see, I will give you 3 examples that we went through it as an American hospital, and how is, as Dr. Omar said, how is just your imagination will stop you what the future is, how it changes. When we started thinking about robotic surgery in the American hospital, Yahya is here, so he's part of the senior management. So the goal was just to boost our surgical department and have a marketing to be the first to B2B. And then we have a senior management meeting, and what we say, let's imagine it. If we have a center of excellence, if we have a training center, let's imagine it will be the destination for the robotic. And exactly this is what's happened. We opened the first Da Vinci room, operating room, and we didn't buy the robotic only, but we bought also the simulation for the training. And we opened a training center with partnership with the Da Vinci company initiative. And that attract a lot of trainee. And we see now people kind of have an opportunity to know what the UAE can offer. And so far we train more than 12 physicians from abroad, not from the UAE, and more than 20 physicians from the UAE just through the robotic services. Again, we did see the same when we adapt the AI protocol in certain area. We adapted in the breast unit with the mammograph early detection. We adapted with the colonoscopy, and we say, well, let's partner with a bigger company. We partner with Cerner, and we opened the first research, AI research. What we're collecting the data to see if we validate or we prove the unapproved, as Dr. Omar say, to go to that sections. The same thing with telemedicine. At the beginning, we say, well, we need to access our patient during the pandemic. And then we found ourselves partnering with Etisalat, and we're reaching not only to our physicians, not only to our patient in the UAE, is actually even internationally. That's opened a lot of opportunity for the hospital. So I agree with Dr. Omar. Just imagine it and push for it and have your team ready to accept it.
Dr. Raza, how is Arabian Health Group contributing towards innovation in the UAE? And what are your key areas that you focus on to make the UAE the hub when it comes to that sector?
So I represent Arabian Health Group and run a hospital called RAC Hospital in Ras Al Khaimah. And it is a good news that this is the only hospital in the entire Middle East, to best of my knowledge. I am responsible to be connected there. That second largest American hospital group has invested money. That is Dignity Health, Common Spirit, which owns institutions like Texas Heart and Baylor's College. So the hospital is going to be the first modular hospital constructed in a factory and to be erected within 12 months. A smart hospital with latest technologies and going to promote UAE and Ras Al Khaimah as a medical tourism destination through top-of-the-line technology, which is navigation and metaverse. Like, for example, a patient sitting in Ethiopia, Addis Ababa, will be virtually given a walkthrough, and also through metaverse will be able to talk to the physician virtually before coming to for the hospital. So these are some of the real uses of technology which we are going to make use of and make it a role model, because UAE is all about innovation, about first time, and this is what we are going to do with that. Thank you.
Welcome. Omar, I have 0 on my screen. Do I go on or?
We can probably open it up for one question before we move on.
The what?
One question if you want to take from the
From
audience.
the crowd?
Yep.
All right. Does anybody over here?
Omar, just to add, we've been going on for the last 20 minutes. We still have another 10 minutes to go, right?
No, if the clock has run out. Then
No, actually, the clock started at 20 minutes.
He's a rebel.
It started at 25.
Yeah. No, don't. Anyway.
Hi everyone, my name is Raza and I'm the CEO and founder for Shawarna. So our work is related to healthcare technology, AI, virtual reality, and even NFTs. So I wanted, Dr. Omar, he mentioned that you have opportunities for startups or private companies to kind of get involved with you. So I wanted to know what's the process to go through and how to approach that. Right now, we've done projects where we're covering even burn victims, so from the outer layer of your dermatology into your internal body organs. Another thing is, recently we have legal liability. So in Saudi Arabia, they're shifting the legal system between the hospitals and the judicial courts. So in that case, what is the regulatory, referral system that we should go for to kind of comply here, especially since we're moving also into cryptocurrencies and accepting that even the Jalila Foundation is now accepting cryptocurrencies to fund the patient records and their journeys. I also have a second question for you. So I want to spell it right. Yeah, Mr. Robert. So in your case, you have the files and the records for the patients, and we can use that data and shift it into the virtual reality system and improve on it. So again, what is the process to approach you as a startup and kind of get that data, improve on it, improve on the materials that we have for virtual reality, and use the local talents that we have as well, the international ones, to kind of progress that further? Thank you.
Dr. Omar, you want
Yeah, so I'll answer the one about the ecosystem. So you're absolutely right. Everything around the ecosystem needs to be right. From the first exciting individuals to go into the innovation space and start developing ideas and taking these ideas from a very simple on the back of an envelope, the sketching all the way to providing care and connecting with the likes of Malaffi or American hospitals or Pure Health, or any of the others to take that idea forward. So from that end, we are working with universities, we're working with philanthropic institutes to get them to fund a very early high level of failures startup. And then we move them once a concept has been proven, they go into Hub 71, which is the primary focus now. And in Hub 71, there is lots of support being provided, and there are a few other incubators. So I know for a fact that Pure Health is developing their own incubators in that space. They are developing their own funding. There are the likes of Mubadala. The ADQ is developing another funding mechanism for early startups. And then you go through the different phases of the startup journey. Once commercially it's being proven into early stage or growth, and the likes. And there are the likes of ADQs, the Mubadala, Pure Health themselves, GeForce 2, all of them can take that forward. The first port of call is communicate with the Research and Innovation Center, which belongs to Abu Dhabi, or the Hub 71 guys, if it is the idea. And I didn't get the part about the cryptocurrency, but I would like to say that, again, it's back of what's going to happen in the future. The cryptocurrency for me doesn't excite me. What excites me is the technology behind it, which is the blockchain. And that's what's happening. I think one of the previous speakers was talking about medications and pharmaceutical, and the biggest opportunity in pharmaceutical is how do we blockchain our pharmacies and our medications in order to reduce 10 to 20% wastage of medications that happen across the globe every year. How can we do it to make sure that the right medications arrive at the right person at the right time and in the right conditions? I think that's what excites me. Cryptocurrency, I'm not an expert on it, but it looks exciting on the news, but not for me yet. I'm sure it will come to catch me and I get hooked on it at some point, but not yet.
And I'll be brief because I know we're out of time. I'm a fan of cryptocurrencies too, and blockchain. But
I was like, he's the crypto guy.
That's a whole different topic. You bring a very important question, so I'm glad you asked this. Since we do have as I said, approaching 1.2 billion records today in our repository, and I've said this since day one, and I continue to say this. Data moves at the speed of trust, so we're very careful of how people can access the information. Today we serve it up to physicians through a secure portal that's integrated with their EMRs, and now we also released a health portal just a couple months ago. Malaffi app, you can download it if you're a resident of Abu Dhabi and access your medical record through your Apple Store or Google Play Store, and so patients can get the access to the information. Now we do believe there's lots of use cases in the future for different devices and whatnot, so we've built an API layer, and we'll only allow access through sponsorship of the Department of Health today. That's an important piece of the equation. We take data stewardship extremely seriously, and so we always get approval of DOH before we serve up in other use cases. So, through the Department of Health, absolutely, they'll let us know, and we'll work with third parties to get access as needed.
Just to add, your data is yours. So just one of the things we're working on it is when you get your app, if anybody accesses your information, you will get a text message saying somebody is accessing this information, deny or allow, and then we'll take it. So if you are sitting in the front of the doctor and they are accessing, or a pathologist is accessing, you will get to know. If there's somebody 200 kilometers away, you will get to know, and then you will say, okay, there's something happening there. I think it's very important just to reiterate what Robert is doing.
Well, thank you so much. And I want to thank Forbes and Pure Health for giving us an opportunity to speak about how to make the UAE the next health innovation capital. And it is part of the country's vision, and it is doable. Nothing is impossible for this country. Thank you so much.